I'm going to be discussing the big five physical effects of cancer treatment. So there's a national study from the Canadian Partnership Against Cancer, and it reported that after cancer treatments ended, 80% of patients reported physical challenges, 70% of patients reported psychosocial challenges, and 40% of patients reported practical challenges such as returning to work. So we know there's a lot of physical effects after cancer treatment. We will now do a poll question. I hope you all had a few minutes to answer the poll question, and I will look at the results now. Can't see lower down. Like, no, I can't see. There's 10 answers. Yeah. Sorry about that. It looks like overwhelmingly, if we can go back up a little bit with the poll. There we go. Okay. Um, Overwhelmingly, 76% of you have fatigue after your cancer treatments, and 40% have weakness. But there's quite a good smattering of all these other areas, such as peripheral neuropathy, poor balance, returning to normal activities or work, lymphedema. So all of these, some of you are experiencing for sure, but it looks like overwhelmingly it's fatigue and weakness are the biggest in the polls. So we're going to be talking about a few things. It's not advancing. So even though fatigue was one of the top issues that people are reporting, I'm not going to be talking about that today. I'm going to be focusing on these five that you see on the screen. And there's a lot of interplay between all these issues. And so it's not just, someone has weakness and their mobility is fine. So a lot of them are connected together. But these are the five I'm going to be talking about today. So the first one is poor mobility and function. And joint stiffness and limited range of motion can affect our general mobility and function and results in poor balance, your increased falls risk, also challenges with your walking, and also limits your activities of daily living, which could be doing laundry. It could even be getting dressed sometimes or bathing. So all those daily activities. There sometimes can be transportation difficulties, maybe if you cannot get in and out of a vehicle easily, or it could be, walking places and things like that. And there's also delayed or inability to return to work. When you have poor mobility, poor function, sometimes you cannot go back to some of your normal activities, including work. The other area is weakness and deconditioning. And this is muscular weakness, which is, from inactivity, a low fitness level. That can cause, of course, weakness and deconditioning, and that can result in fatigue, which a lot of you have reported you have, limited tolerance to cancer therapies. Again, walking challenges and limitations in activities of daily living can result in a poor quality of life, and again, that delayed or inability to return to work and other day-to-day activities. So I'm putting these together because there's for sure an overlap. So your poor mobility and function, weakness and deconditioning. The physiotherapy management we do for this is, first of all, a thorough assessment of your mobility, your function, your strength, and also determining your goals. Whenever I do physiotherapy, I don't impose my goals on a patient. I like to know what is important to them. Is it important that you can play with your grandchildren? Is it important that you need to go up and down the stairs without difficulty? Is it important for you to be able to go grocery shopping or maybe go back to playing tennis? Whatever it is, I want to match my treatment to your goals. So it's very important that I assess all that and determine what your goals are for your own recovery. I also provide a lot of education to my patients, which involve physical activity. how to manage fatigue, and maybe also coping and adaptation as well, related to some of that weakness and deconditioning. And of course, exercises is a huge component of what needs to be done for helping combat this mobility and weakness. And so I often give my patients full body strengthening. So when you've gone through things like chemo, there is a weakness to your whole body. And unfortunately, people that undergo chemo do lose weight, and that weight they lose is muscle mass. So it's important to do a full body strengthening program. And that's for mobility, for strength, and also fitness. And within that exercise instruction, also trying to maximize someone's functional independence. So they don't have to maybe get help, getting out of a chair or whatever it is. We want to have them functionally independent. And then also at the physiotherapy management, I talk about the physical activity specifics. So I don't want to just tell people go and exercise. I need to be very specific in how they do it, maybe making a plan and what is recommended for recovering after the cancer treatments and doing it slowly and so forth like that. So it's very specific physical activity recommendations. The next one I'm going to be talking about is impaired balance. And again, there's a lot of interplay between weakness and so forth, but impaired balance can be related to inactivity, definitely chemo-induced peripheral neuropathy, lower extremity weakness, and also your balance is less or is poorer when you have a fear of falling and low confidence. Like you're not going to go and do all your activities because you have that low confidence about your balance. So sometimes that can be a vicious cycle where you don't do activities and you or walking or whatever because you're afraid, and you're afraid because you don't want to fall. So it gets into this vicious cycle. There's many other factors that do affect balance, and that would be dizziness, medication side effects, an unsafe environment. So if you have a cluttered house and hallways, that is very unsafe, and so your chances of falling are even greater. Poor vision is another thing, and also multiple health issues. So there's other factors with impaired balance. It's not just the ones related to your cancer treatment. The next thing I want to talk about is chemo-induced peripheral neuropathy. And this is a peripheral neuropathy, which would be things like numbness and tingling as a side effect from the chemotherapy drugs. And it's mostly the taxane drugs. And this can cause damage to the peripheral nerves. And this is most commonly affecting the sensory nerves in the hands and feet. So what the symptoms are of this is numbness, pins and needles, or the tingling. It can be pain. It can be hypersensitivity. It can be burning and coldness. Some of my patients only have a couple of these symptoms. Other people have all of them. So it really depends on the severity of the neuropathy. And it can be very mild or it can be quite severe. And in some cases, it also affects your motor function, which could mean that you have a foot drop or something like that. But it can vary in severity quite a lot. So I don't know if this represents some of what you're feeling if you have peripheral neuropathy, but it's not it's a very troubling side effect of cancer chemotherapy. So the peripheral neuropathy can cause, of course, multiple limitations and negative effects. And so obviously your increased risk of falls and a higher incidence of falls. It affects your walking and your balance for sure. It causes you to be less active. It limits your use of your hands. So sometimes maybe you can't put on earrings or do up buttons or do crocheting or whatever it is. So it limits your hands. And some people also report dropping things because they can't feel properly with their hands. So they drop things, break things sometimes. And of course, there's increased risk of injuries in the feet and hands because of poor feeling. Maybe you can cut your hand or your foot and not really know it very much. And it also leads to poor quality of life and sometimes the inability to return to work. Now, unfortunately, there is no fix for the nerves. It's only really management of the symptoms. Having said that, though, what happens when you finish the chemotherapy, you can get regeneration of the nerves, which means that the nerves can regrow and you can have a reduction in the symptoms. But there's nothing anyone can do to cause the nerves to regrow. They just regrow and regenerate, recover as they will in your body. But what we can do is to help the symptoms. And so sometimes there's medication that is provided to help reduce some of the symptoms. Sometimes exercise can help. Sometimes what I provide is an acupuncture. It's a certain protocol that I do to help reduce some of the peripheral neuropathy symptoms. With any of these things like medication or any physiotherapy, acupuncture, there's absolutely no guarantee it's going to work. Um, it's something that is worth trying, especially something like acupuncture, because if it helps you, there's very few bad effects from the acupuncture. Whereas medication, yes, it can help you, but then you might be dealing with other side effects, which can, cause other problems, obviously. So recovery with peripheral neuropathy is very individual and varies a lot. Most of my patients will get some recovery in the first year after they finish chemotherapy. That's sort of the crucial time where you're going to get a lot more recovery of the nerves, year to 2 years. Some people might get a 50% improvement, some people 75%, some people it resolves 100%, other people 0%. So it's a very individual recovery regarding peripheral neuropathy. So, like I was saying, the management is what I provide in physiotherapy and sometimes medication, and for sure, exercise. So when I'm assessing somebody with peripheral neuropathy, again, I have to do a thorough assessment of it to see sort of how bad it is and also ask questions about how it interferes with their function with their hands or their feet and balance and so forth. I also give people a lot of education regarding protection. I'll give you one quick story. I had a patient of mine that had very poor sensation in her feet. She had what we call diminished protective sensation in her feet. Someone broke a glass in her kitchen and they cleaned it up. The next day, she was walking in the kitchen and all she saw was a trail of blood. There was a little tiny sliver of glass that got into her foot. She could not feel it. And so all there was blood that she saw. She could not see it or feel it. So there's a lot of education around that. And usually what I recommend to people with peripheral neuropathy is they wear shoes inside. Something very fitting to the shoe, not a floppy slipper, but something like an indoor pair of runners or a well-fitting slipper inside the house, especially if you have that really poor sensation and lack of protective sensation in your feet. So education around this is very, very important. And obviously, I do instruct people in exercises. There are some nerve glide exercises which can help. There's strengthening, and I do a lot of balance and agility exercises and also general physical activity. The balance and agility exercises are very important because that not only it doesn't sort of cause your neuropathy to go away, it basically gives you better confidence in what you are doing. And so I have seen someone's confidence level go from 20% confidence of their balance to 80% confidence. So doing some of those balance and agility exercises increases someone's confidence and they do better with their balance. So that's important. And again, it's not going to resolve the neuropathy. There's also, I do a lot of education around their walking, their gait, and some people need aids. They might need to go to a cane or a walker. No one wants to have to use that, but if it's important for your safety that you might need something like that. And then the symptom management. So that would be things like the acupuncture. And it could be TENS, which is an electrical stimulation. There can sometimes be manual treatment. Sometimes people, you know, like to have a really good foot massage and that kind of thing. Again, that probably will help temporarily, but it's certainly something that can give people relief. With the acupuncture, I generally do a certain protocol and I offer people at least 4 sessions of a trial of the acupuncture. And if in 4 sessions it doesn't do anything at all, then I would stop the acupuncture. If the acupuncture does reduce some of the symptoms like tingling, numbness, coldness, whatever the symptom is, then we know it's successful and helps them, and we can continue the acupuncture. Usually those 4 sessions I do, weekly at the beginning, and then if it is successful, then I might have do acupuncture follow up in maybe 3 weeks, 4 weeks, or something like that. So I've actually had about 70% success rate with acupuncture. So that's definitely something I treat a lot, and it is unfortunately a big problem with certain chemotherapy drugs. So, as you heard, I'm a certified lymphedema therapist, and one of the side effects that does occur with cancer treatment, so that would be specifically lymph node removal and also radiation, is a secondary lymphedema. And basically, lymphedema is a swelling in the tissues of any body part throughout our body because of blockage or poor functioning of the lymphatic system. So you get swelling, and that swelling is a high protein swelling, and it can occur in any body part. So it can occur in the arms, the legs, it can be even genital swelling, it can be breast, it can be head and neck swelling. So it can be anywhere in your body. So some of the data related to that is that cancer-related lymphedema affects 155,000 Canadians and about 5,500 Manitobans. And as I just said, it affects these different areas, but that would be people with breast cancer, gynecological cancers, genitourinary cancers, melanoma, head and neck, sarcomas, and prostate cancer. Those are the most common. I mean, there are other types of cancer that can cause the lymphedema as well. So as I already said, the contributing factors in cancer patients are the removal or damage to the lymphatic vessels and lymph nodes. So unfortunately, lymph nodes do not grow back, but there is research that shows the lymphatic vessels can regenerate. So, but sometimes that's, not complete regeneration. So basically that lymphatic system is damaged. So for, let's say, breast cancer, you have lymph nodes removed at your armpit and you have radiation to that area. That area is at risk, especially your arm. It could also be your chest or your breast. So that area is at risk. And the risk is higher for lymphedema when you have more lymph nodes removed. And radiation also is a risk factor. But if you, let's say, have 20 or 25 lymph nodes removed versus 2 or 3, your risk is going to be higher with the 20, 25 lymph nodes removed. There can also be a blockage of lymphatics from tumors. So if there's a tumor in an area that is blocking the lymphatics and the lymphatic drainage, then you can also develop lymphedema. And this chart just shows you some of the percentage. So all cancers, 17% of all cancers, there is a risk or that people have the lymphedema. And the highest is not breast cancer. It's kind of surprising. The highest is not breast cancer, but the highest is head and neck cancer. And I have actually been seeing a lot more head and neck cancer patients. I mean, there's not just lymphedema, but there's many other physical effects. So it could be limited range of motion, tightness. It could be difficulties with even swallowing and things like that, which I don't treat as a physio, but there's so many issues with head and neck cancer, and 60% of head and neck cancer patients have lymphedema, which is pretty high. And the others, as you see, are not as prevalent, but there's quite a few that do result in lymphedema. And these are just some pictures of various lymphedema. Um, the one on the bottom left is one of my patients, and she had a cervical cancer and significant lymphedema. And as you can see, her left leg is unaffected. It's a normal size, but her right leg was so significantly affected. And unfortunately, she did not get in for treatment quickly enough. I mean, she had a late diagnosis, was not on treatment right away. And so has significant lymphedema. And actually, there's a fold by her foot, which actually was dragging on the ground. So very, very debilitating. And you can see on some of the head and neck or the facial pictures, the top middle is a patient that's how he was when he came in. And then the next photo is how he was when he finished some of his lymphedema management and other physiotherapy. So I just wanted to show you a few pictures of what it can look like and sometimes how bad it can be. So obviously with lymphedema, there's chronic swelling. It's sort of there, like it's not something that goes away necessarily. There's often limb deformity, as you saw in those other pictures. There's excessive protein in the tissues, so it's a high protein fluid. It's not just regular um, swelling, I would say. It's a high protein swelling. There can be chronic inflammation. So in that area that has lymphedema, there's chronic inflammation in that area. There's also very slow wound healing. So when you have a wound, um, even a sort of a cut or a nick, you're very prone to, unfortunately, getting, maybe an infection, but it heals very, very slowly when you have lymphedema. There's also local immune deficiency in the tissues, which results in the increased risk of infections and also cellulitis. So cellulitis can be quite serious, and it's something that you need to get on antibiotics immediately for, and it can be quite serious. So you are at higher risk for that when you have lymphedema. You can also get skin changes and fibrosis. So some of those pictures I showed you, the skin can become very hardened and thickened, which of course is feels worse for your limb. And of course, you have a lot of heaviness in those limbs. And so there's a lot of secondary sort of problems that can occur related to lymphedema. So also, of course, there's a loss of mobility. You have decreased range of motion. So I don't know if you can imagine, you know, carrying around a leg like that, you're not going to be as mobile. And also, you're not going to be able to bend as easily, like your arm or your leg, if it has lots of swelling. And of course, that's going to translate to functional deficits, like being able to walk, get in and out of a car, go up and down stairs, and difficulties with your ADLs, which is your activities of daily living. So your general sort of care of yourself, like it could be washing, dressing, it could be, shopping, whatever it is, or working in the kitchen and so forth. And when your limb, especially your hand or foot, you're going to have much difficulty wearing normal shoes and also clothing. So certainly if you have a lot of edema in your foot, you can't wear just normal shoes. So that's another, effect that it has is it's your clothing and shoes. And of course, when you have that kind of swelling, it's going to create a negative body image and poor self-esteem. And sometimes people, don't want to go out. They become more socially isolated. And there's many psychological issues along with all of that. Now, not everyone gets all of this, obviously, when they have lymphedema, but you can have more serious and severe consequences if it's poorly managed or even left untreated. And so that's what, again, happened to that lady in the picture of my patient. She was left untreated for a long time and very poorly managed, and it got more and more severe with all these effects from the lymphedema. So there's 5 components of complete decongestive therapy, and this is provided by a certified lymphedema therapist. And the first is a manual lymphatic drainage, which is a very specialized lymphatic massage. It's not just regular massage, it's very specified. And it's basically the 2 principles are the sequence of what you do and also the direction. The second is compression bandaging and compression garments. So we need to get that volume down. So when I see patients with lymphedema, I measure actually their legs or their arms, and I actually determine the volume of that swelling. And if it's obviously one-sided, I can compare it to a normal side and the swollen side. And we want to get that volume down. And so one of the things you can do is called compression bandaging, which helps to get that swelling down. And then the goal after that is to get them in compression garments. And I'm sure you've seen compression garments on people, or maybe you've had some yourself. And so the goal is to get that volume down and then hopefully be able to, get them in some compression garments that they can wear and fit and all of that. So there's also lymphedema specific exercises that help to stimulate the lymphatic flow, but any exercise helps lymphatics. And also, I like to get my lymphedema patients doing general physical activity, which is again important for our overall health, but also for lymphatic flow. The other area of managing lymphedema is the skin care and nail care. I already mentioned that some people have some problems with possibly getting a wound or an infection, and you need to be on top of taking care of your skin. So that means if you do have a cut or a nick, keep it clean, use some antibiotic ointment on it, that kind of thing, keeping it clean and watching that it doesn't get inflamed or infected. Also taking care of your nails, not cutting into cuticles and things like that, protecting your skin when you can, which would be wearing gloves if you're in the kitchen sink or, covering your feet if you're in the garden and that kind of thing. So those are the four main components of lymphatic management. The fifth is actually the most important because as a therapist, I'm not with you every day. It's your self-management that is so, so important. And so what I do is I educate my patients in that self-management. So I teach people how to do the self-lymphatic drainage massage. I can teach self-bandaging. I talk to people about when they get garments to regular use of their garments and practicing their home exercises and also making sure they're maintaining healthy skin and nails. So that self-management for my patients is very, very important. And actually, it doesn't just apply to lymphedema, it applies to all these things we're talking about. What you do for yourself at home is vital. So it's not just coming for a magic pill or a magic treatment, it's things you do at home as well that help you manage all these conditions. These are just some pictures of some manual lymphatic drainage and some on the right side are the arm and a leg, which is at the compression bandaging. And there was just some examples too on the other side of some of the compression garments. And just to clarify, compression garments for the arm and leg are worn during the day. Anything at the head and neck is worn at nighttime. So the reason for that is, and you maybe are familiar with this kind of thing, that you will get more swelling in your legs or arms with gravity. Like, so if you're upright moving around, you will get more swelling. So that is when you wear the compression garments. For the head and neck, it's worn at night because when you're horizontal lying down, the head does not drain as easily because you're horizontal, and so you wear the compression during the day. Everything, all lymphatic fluid drains to the heart. So you can understand, if you're up and around, it's going to come into your legs more. And maybe you've seen that when you fly and things like that, even if you don't have lymphedema, maybe you can have a bit of swelling in your feet or something like that. So that's some examples of the compression garments. Now we're going to go to our poll question number 2. So what was everyone's answer? Can I see that? Very good, everyone. You were listening. So that's good to know. So what we're going to talk about is exercise right now. There we go. So in my role as a physiotherapist and also with cancer recovery, exercise is a very important thing that we need to do. And so that's one of the best ways to recover from cancer and cancer treatments. And there's scientific research that shows the definite benefits of physical activity both during and after cancer treatments. And this lists all the different things. So it can help reduce your cancer-related fatigue. It can increase your range of motion, of course, and your muscular strength. It improves your aerobic capacity and helps to reverse deconditioning. It improves your immune function. It can improve your balance. It can reduce brain fog. And this one I really like. It can improve tolerance and effectiveness of cancer treatments. So this is, again, proven research. When people are on chemotherapy or radiation, when they exercise, it actually improves their tolerance to that treatment and also the effectiveness of that treatment. And I think that is a huge thing that we need to do when we're going through some of these treatments. And I know I do see majority of my patients I see after they've done their treatment, but those that I see during chemo, during radiation, I encourage them to exercise. And it might be just a 10-minute walk if they can. So it might be something very minimal, but it's something. And so that is a very crucial thing, I think, for when you're on cancer treatments. Then also it improves your sense of control and your mood. And often with cancer treatments, when you've had cancer, you don't have that control over what's happening with your body. Yes, you consent to things, but you really don't have a lot of control. And so when you choose to exercise and choose to do things with your body, that gives you that sense of control. And of course, again, this is researched. It increases your chance of survival, reduces the risk of recurrence, and improves your quality of life. So with that list, I can't see much downside. So I hope you can relate to this little comic here. Exercise is actually all for all of us, any time of, any age, any medical condition. So this is what I'd say here. It's no matter what your medical condition and at any age. There's national guidelines for physical activity, and I'm sure you've heard this before, is 150 minutes of moderate intensity physical activity per week. So that's basically 30 minutes, 5 days a week. And for most people, walking is the easiest and most common form, and it's, least amount of money and so forth. So walking is often what a lot of people do. And as I said, there's many benefits, but minimal downsides. And it's very vital to helping us get through cancer treatments and recovery after cancer treatments. I know in my bio, there was stated that I've had breast cancer, which is true. I'm now 16 years post breast cancer, and I exercised through my treatment, which absolutely helped me in my recovery. And so I know for myself it was vital. And so that's what I try and encourage my patients to do as well. I know with exercising when you've had cancer, you have high levels of fatigue, you have bad days, and that's okay to take a break from things, but you want to sort of get back to it, the next day. So take one day off and then try and get back to it. When you take 2, 3, 4, 5 days off, then you get out of your routine. Exercise always needs to start at a low level and with slow progression and done within your tolerance. Like I was just saying, if you some days you can't do anything, that's okay. And as a physiotherapist, that's a big part of what I do is guiding people through the right exercises, learning how to do them, when to do them, how to progress them, and so forth. And these are basically some tips. You want to avoid that inactivity and try to return to some of your normal activities as soon as possible. Again, I always already said to start slowly, build up gradually. And you can actually exercise several times a week for 10 minutes at a time. So you could do 10 minutes in the morning, 10 minutes in the afternoon, that kind of thing. And you also, it's good to include some resistance and stretching exercises as well, some strengthening and stretching exercises. And this is actually the physical activity guideline. It's actually the UK publication. I just like how it's outlined. This is actually across the world. This is for people with any health condition. So they could have diabetes, they could have cancer, they could have heart disease, arthritis. They could be perfectly healthy, but these are the guidelines for everybody. So it's 150 minutes of moderate intensity, which means your heart rate is up a bit and your breathing's up a little bit. And it also talks about sitting less, building strength, and improving balance. So this is the guideline that I share with my patients. And these are just some pictures in physiotherapy from a little while ago, some of the equipment and the space that we use. So with exercise, you want to keep it safe. You make a plan. If you fail to plan, you plan to fail. So you want to make a plan and focus on fun, like things you enjoy, and make it work for you. Thank you very much for listening today, and I believe we have some time for some questions.
Okay, great. Karen, I know how difficult it must be to compress for all of your wisdom and knowledge and experience into just 40 minutes. And I don't know if you can see all of the hearts and applause that people are responding with. So, yes, we don't have a lot of time for questions, but one that has come in was about how to get a hold of you. And so, what I did was I put our Center for Hope main line in the chat. But are there other ways, Karen, or is
On
that the
the
one?
screen, it has my email and my phone number. Um, so I will tell you about referrals. And of course, this is a Winnipeg. It's not sort of up north or anything like that. So I do take self-referrals, but I also take referrals from health professionals within cancer care. So that could be an oncologist, nurse practitioner, even the psychosocial clinicians, dietitians, you name it. So I take it from within cancer care, but also self-referral. So if you want to refer yourself, that's the contact information. So my email or my phone number. And I will warn you, I'm not full-time at Cancer Care, and unfortunately, I do have a 3-month wait. You can also contact, like Cheryl said, the patient and family support services. They actually, that's where faxes go, and they actually, put names in my database of people that are referred to me. So that's where you can contact as well. And did you put the phone number on there, Cheryl?
I sure did.
Phone
Yes,
number and maybe a fax number, I don't know. So yes,
absolutely.
you can contact them as well. So, but just keep in mind, I have a long waiting list. And also, I will say if you have private insurance and you can use your private insurance, go to private practice physio because um, you know, it's unfortunately a long wait, and there's many people that don't have private insurance that have no choice but to wait. And unfortunately, there's not a lot of funded physiotherapy in our province. And so, but if you have private insurance, go privately for sure.
Okay. A question here, Karen, about flying and the experience of ears being blocked. Is there anything that can be done before the flight or during the flight? I know that's a big question.
That's not in my wheelhouse
Oh,
about ear
okay.
blockage, but I will talk about lymphedema. So if you're at risk of lymphedema or have lymphedema, you need to wear compression during a flight. So for your legs. So maybe you have known that, sometimes when you fly, you get puffy ankles, that kind of thing. Or if you do have lymphedema, it can be a lot worse with flying. So you need to wear compression garments. And sometimes it might just be an over-the-counter compression sock which can help the swelling in the feet and the legs. But for sure, if you have lymphedema, if you have lymphedema actually in your arm or your legs, you want to wear compression when you're flying because there's a change in the pressure. And so you want to, reduce some of that effect to your limbs. So the ear pressure, I don't know. I don't think you can get around that. And that's sort of out of my wheelhouse.
Okay, so great. Two more questions in about 2 minutes, Karen. After lymph node removal, can the remaining lymph nodes regenerate pathways to help drain areas affected?
The lymph nodes do not regrow. So once a lymph node is removed, it it's gone. But what I was saying before too is that there's research evidence that shows lymph vessels. So it's sort of like a blood vessel that travels between the tissues and to the lymph node, and then from the lymph node to the heart. So those vessels it's shown that they can regenerate and even across scars. So I have patients that have head and neck scars, across their neck. And I mean, I don't know for the individual what's happening with the lymphatic vessels, but the research has shown that the lymphatic vessels can grow across a scar, underneath a scar. So we do know that does happen, but in the individual, we don't know how much that happens. But as a lymphedema therapist, I do my treatment for that area, assuming that there's some lymphatic vessel flow. But lymph nodes, once they're gone, they're gone. And we don't know also how many we have. So let's say you had 20 lymph nodes removed from your armpit, you may have 10 left. Or same thing with the groin. You may have some lots removed, but there might be some left, and also the head and neck. Majority of our lymph nodes are in our head and neck because it's a portal to our body. So, but when you have a neck dissection, they can sometimes take 30 lymph nodes there, but still there's others that are there. So even though they don't grow back, it's not like there's no functioning at all of your lymphatic system. There is some still functioning, with other lymph nodes and also with the regrowth of lymphatic vessels.
Okay. And one last question. We have about 30 seconds for it, Karen. Do you have a good website for strength exercises?
No, the reason being is that it needs to be very individual. I know so many people now do their internet searches and go to Dr. Google. And I mean, yes, you can learn some good things. And if you maybe have experience exercising, there may be some things you can learn and do. But I believe after a cancer diagnosis, it needs to be very personalized and individualized. Unless you're really experienced with exercise. Like if you've already done a lot of exercise and you are off your routine because of your cancer treatments, sure, you can do that, or maybe do things you did prior. But I don't generally recommend just going to a website. I mean, it's better than nothing, though, of course. I mean, if you can't have access to me or another physiotherapist, then yes, you could do things, but also you need to do safe things. So, I don't know the individual situation, so it's much better doing it with guidance, um, seeing some professional that can help you through that.
Oh, great answer, which is really what you see from day to day, Karen, in your
Mhm.
work. So, on behalf of the team here and all of the viewers that are, again, have given their feedback with the hearts and the applause there that I hope you see. Thank you, Karen, for
You're
lending
very
us your.
welcome. I'm very happy to share my knowledge, and if it can help someone, that's what it's all about.
Oh,
Yeah.
absolutely.
Have a
So,
good rest of the day.
thanks, Karen.